A patient who is 67 years old, diagnosed with heart failure, and now using enalapril, which is ACE inhibitor, which is lowering the blood pressure, and it can cause dry cough, and also uses ibuprofen. Ibuprofen is non-steroidal anti-inflammatory drug for headache, and they took ibuprofen. Okay, so just a rule: once you combine ACE inhibitors with non-steroidal anti-inflammatory drugs, you're going to be seeing that the effect of ACE inhibitor is reduced. This was used for high blood pressure, right? It was lowering the high blood pressure. But once you take it with non-steroidal anti-inflammatory drug, it's not gonna work and your blood pressure will go up. So this drug won't give us the effect that we want once you take it with non-steroidal anti-inflammatory drug. And yeah, that's it. This person sees high blood pressure, just like we said. This person sees headaches, but why did the headache happen? Because once the blood pressure is changing, you will see headaches. That's normal. What's the advice? Okay, so he's considering taking aspirin. No, he's not going to take aspirin. Non-steroidal plus aspirin, we don't want that. Also, aspirin is not a need right now. Just take paracetamol if you still have headache. That's it. And for the second one, we have a 75-year-old patient who is treated with empagliflozin, which is SGLT2, used in diabetes mellitus. This was removing the glucose with urine. So it has effect of the, it will cause dehydration, right? Because this causes osmotic diuresis. So this will cause dehydration. It will cause urinary tract infections and genital infections. This was just a reminder. And also uses dihydrogenol. Dihydrogenol is a diuretic. This will also cause dehydration. Alright, so this person sees what? Dizziness, vertigo. Dizziness plus vertigo. What do I need to remember? This is hypotension. But why did hypotension happen? Because once you take SGLT2 with this diuretic, you will see hypotension. And also solve nausea. Nausea is due to, again, empagliflozin. And actually nausea happened because of the dehydration. Once you have dehydration, you can have nausea. And we had dehydration just because this is removing the glucose with the urine and this is diuretic. So of course we have dehydration, and this is very dangerous in old people. If you see old people having dehydration, this is very dangerous. We're gonna give oral rehydration solution. So these are happening and we took these. What should we recommend? So I would recommend changing the empagliflozin. We can use DPP4 because this is not osmotic related. That's why we can take DPP4. And then yeah, we have a lady. This lady is using dopagit. This dopagit is known as methyl-dopa. And she is using normally this methyl-dopa during her pregnancy. Now she gave birth and she is looking for methyl-dopa again. What should I tell her? Should I give her methyl-dopa? No, we don't give her methyl-dopa because she's not pregnant anymore. Once a lady is pregnant, and then in the hypertension we give methyl-dopa. Normally we don't give methyl-dopa because it's not very effective, and methyl-dopa can cause some problems like depression once you're not pregnant. So don't give methyl-dopa. You can give from the first lines such as ACE inhibitors or ARB or calcium channel blockers. And now we have another patient. Let's see what's going on. We have a dry cough, dizziness, and nausea. Hypertension, coronary artery disease, he's SOF. And He took enalapril, okay, AC inhibitor, and also he took amlodipine, calcium channel blocker. Now he wants cough syrup. Okay, so dry cough is not due to the something else. It's just because of AC inhibitor. AC inhibitor side effect is dry cough. So instead of giving AC inhibitor, we can give ARB. It's the same thing. But by the way, if it's not ACE inhibitor related cough, let's say that the doctor checked and it's not because of ACE inhibitor, it doesn't change once you give alternative, then we should give dextromethorphan syrup, or we should give there was another syrup which was honey based syrup for soothing. And we forgot to mention why did the dizziness and nausea happen, because these are both relaxing the blood vessels, right? One is AC inhibitor, the other one is calcium channel blocker. This one, where is it? This one is AC inhibitor, and enalapril, amlodipine is calcium channel blocker, so they're gonna cause hypotension. They will cause hypotension, and this will cause dizziness and nausea.